Hello, welcome to the Nurse Scrub Club, where we make learning fun and engaging. To an essential guide on fluid and electrolyte imbalance, a critical topic that's vital for both medical professionals and beginners alike to understand for effective patient care. Our bodies are intricate systems where fluids and electrolytes play vital roles in nearly every physiological process, including nerve signaling, muscle contraction, and maintaining proper hydration. Think of fluids as the rivers and oceans within us, constantly moving and carrying essential cargo like nutrients, oxygen, hormones, and waste products to keep our cells functioning optimally. Electrolytes are like tiny charged passengers, key minerals such as sodium, potassium, calcium, and magnesium that help maintain electrical balance, pH levels, and osmotic pressure throughout the body. When these fluids and electrolytes fall out of balance, it can lead to significant health issues, ranging from mild discomfort like fatigue to life-threatening conditions such as seizures or cardiac arrest. Let's start with sodium, or Na+, often called the water magnet, because it primarily dictates where water goes in the body by regulating osmosis across cell membranes in intracellular and extracellular spaces. Hyponatremia, or low sodium levels below 135 milliequivalents per litre, can occur from excessive water intake, SIADH, or sodium loss via diuretics, leading to symptoms like confusion, nausea, headaches, and severe seizures. Conversely, hyponatremia, or high sodium above 145 milliequivalents per litre, often results from dehydration, diabetes insipidus, or inadequate water access, causing intense thirst, dry mouth, and altered mental status like restlessness. Next, we have potassium, K+, which is crucial for nerve impulse transmission, muscle contraction, and especially maintaining the heart's electrical rhythm through its role in membrane potentials. Hypokalemia, low potassium below 3.5 milliequivalents per litre, can cause muscle weakness, cramps, constipation, and dangerous heart arrhythmias like ventricular tachycardia seen on ECG. Hyperkalemia, high potassium above 5.0 milliequivalents per litre, is equally serious, often from renal failure or cell lysis, potentially leading to peaked T waves on ECG and sudden cardiac arrest. Calcium, K2+, represented by purple, is vital for bone health and mineralization, blood clotting via factor activation, and nerve transmission through depolarization. Hypocalcemia, low calcium below 8.5 milligrams per deciliter, can manifest as muscle spasms like tetany and paresthesia with tingling in fingers and toes. A key indicator is Chvostek's sign, where tapping the facial nerve in front of the ear causes twitching of the facial muscles. Another is Trousseau's sign, where inflating a blood pressure cuff on the arm induces a carpal spasm, causing the hand and fingers to contract. Hypocalcemia can also lead to a prolonged QT interval on an ECG, increasing the risk of arrhythmias. A key indicator is Chvostek's sign, where tapping the facial nerve causes twitching of the facial muscles. Hypercalcemia, high calcium above 10.5 milligrams per deciliter, can lead to kidney stones from hypercalciuria, bone pain from resorption, abdominal pain, and altered mental status like confusion or coma. Finally, magnesium, Mg2+, in green, is a cofactor for hundreds of enzymatic reactions, including ATP utilization, and impacts muscle relaxation and nerve function stability. Hypermagnesemia, low magnesium below 1.7 milligrams per deciliter, can cause tremors, muscle weakness, hypocalcemia, and cardiac arrhythmias such as torsades de pointes. Hypermagnesemia, high magnesium above 2.5 milligrams per deciliter, often from renal failure or overdose, can result in lethargy, hypertension, bradycardia, and respiratory depression requiring ventilation. Understanding these imbalances is crucial for timely diagnosis and treatment, often involving careful intravenous fluid administration like normal saline or lactated ringers to restore balance. For clinicians, remember the pearls. Always consider underlying causes like medications, renal or adrenal dysfunction, gastrointestinal losses, or endocrine disorders in your differential. For example, loop diuretics like furosemide can cause hyperkalemia and hypomagnesemia by increasing renal excretion, while ACE inhibitors like lisinopril can lead to hyperkalemia by reducing aldosterone. Fluid resuscitation requires careful monitoring of intake, output, vital signs, and serial labs to avoid complications like pulmonary edema from fluid overload or further electrolyte dilution. The body's compensatory mechanisms such as renal conservation or hormonal responses like ADH and aldosterone are powerful but have limits, so early recognition of decompensation is key to intervention. Regular lab monitoring with electrolyte panels, plus a thorough patient assessment including history, physical exam, and ECG are indispensable tools in managing these conditions effectively. By understanding the delicate balance of fluids and electrolytes, we empower ourselves to provide better, more precise care and significantly improve patient outcomes in clinical practice. Thanks for watching the Nurse Scrub Club. See you on the next shift.